Love that. All right, so welcome officially to our Joining the Medical Field panel discussion. We're really excited to have some amazing speakers on here today at different levels of their medical career and at completely different positions within the medical career as well. So there's a lot of great opportunity for all of you to learn a little bit more about the different stages, getting into medicine, getting into supporting patients, and what it all involves. So our speakers today that we're very excited to have. We have Sabrina Hanson, Dr. Jimmy Maiarana, and Emily Weidow, who we're all very excited to have. I'm going to have them go one by one, introduce themselves. So, Sabrina, if you want to go ahead and kick it off.
Hello, everyone. I am currently a graduating senior at the University of Miami. I'm majoring in health science and I'm currently applying to medical school this upcoming cycle. So I'm really excited to see how that goes. I'm really interested in oncology and I've actually worked with Andrew for, I think, about 5 to 6 years now. So I'm really excited about what's to come.
All right, Dr. Jimmy.
Alrighty, yeah, I'm Jimmy. I'm a pediatric oncologist. I'm in my second year of fellowship, so like 7 years post med school, and am a physician scientist. I work partly at Johns Hopkins and partly at the NIH, which is how we met Andrew and one of the other members of Ulman Foundation, Becca. And then just training wise. So did undergrad or did high school, undergrad, University of Richmond. Very common in medical pathway to take time off. Average age of entry is like 24 years old now. Took a couple years off and did some research, and then went to medical school, and then 4 years of residency in pediatrics, and then now fellowship in pediatric oncology.
All right, Emily.
Hi, I'm Emily Weidow. I'm a patient navigator with the Ulman Foundation, and I'm stationed at the University of Maryland Medical Center, where I work every day with the young adult oncology patients. My path to get there was a bit unusual. I went to the University of Maryland for my undergrad with a degree in government and politics. I have a master's in public policy, did some work working in student affairs and higher education with young adults before coming to work with young adults in this field. Um, and I'm a certified patient navigator through the AONN organization.
Fantastic. So, we're going to jump right into the panel Q&A just because with the time that we have, we want to make sure that we got to everyone's question that is here. So again, this is your opportunity to ask questions to anyone on our panel. If you do want to ask a question, please go ahead and submit it directly through chat. If you message me directly, that is the fastest, easiest way to get your questions going. I'm going to go ahead and stop sharing those so we can get everything so you actually see us. Let's start pinning our speakers. All right, so we're going to go ahead and start with some of our first questions. So we already, if anyone, again, so if anyone does, go ahead and start submitting some. I see some coming in. There we go. That was actually my first question. What inspired you to pursue the medical field? This is for all of you. Sabrina, want to go?
Yes, I'll go. I was always interested in science and I didn't really know where that was going to take me. And then I would say my first experience working with healthcare and talking to patients and hearing their stories was with Andrew and LLS in high school. And that made me really interested in oncology. And that kind of sparked an interest in healthcare. I wasn't really sure where that was going to go. And then when I started at UM, I went out and I reached out to a bunch of hematology oncologists because I wanted to kind of see what that field kind of comprised of and if I was really interested in it. So I found a really good oncologist that let me shadow him for 6 months and I absolutely loved it. I really got to know all the patients. I loved how longitudinal the care was, and that really kind of kickstarted my pursuit of becoming a physician. And since then, I've had the opportunity to do research and to work more clinically, and all of that's kind of made my passion grow.
Go ahead, Dr. Jimmy.
I think yeah, I think Sabrina hit it on the head. There's a at least for me it's usually there's some sort of interest in science that I hear out of like applicants or people who kind of come through. Um, eh, and really, I think the two biggest things is like interested in medicine or science, and then a desire to help people. I think those are kind of the two foundations that a lot of people have going in. But other than that, everyone's story is a little bit different. Um, Mine was in college, kind of volunteering, getting some exposure into the medical field. Was part of an organization called Child Life, which pairs hospital volunteers with children who are admitted to the hospital for various reasons, just to kind of have fun, play, and so got a ton of time with two families in particular, and grew really close with them during their diagnoses, both cancer diagnoses, and just kind of had a desire then to try to build new therapies for them, so they had to decrease their suffering. So that's kind of what kickstarted everything. And then once you're on the path, I feel like you just stay on the path.
I actually am doing child life right now at our oncology center. So it's a really good opportunity if your school or college has the position to really get to know people and follow them for a long time.
Um, if you're not interested in the sciences, you can still participate in the health field. As I said, my education is in government and public policy. So my interest has always been in advocating for those who have trouble advocating for themselves. And there are a lot of social justice and barriers to care and inequities in the health field and as it comes to cancer. And so my role as a patient navigator is to help patients overcome those barriers to their cancer care. I work closely with social workers who do a lot of similar work. I help find people transportation to their medical appointments or things like that, or financial support so that they don't have to worry while the lovely doctors like Dr. Jimmy are helping them on the medical side.
All right. Next question. What classes, programs, extracurriculars, or internships would you recommend for a high school student interested in healthcare?
That's a that's a great question, and one that I think whoever asked is kind of like, I think the big question is, what the heck do I need to do to get in? Right? If you're interested in medical, if you're interested in nurse practitioner, if you're interested in nursing, if you're interested in PA, any sort of thing. I mean, obviously, any area of medicine. It's what do I need to do to kind of get into schools which are becoming more and more competitive. And the truth behind it, really, that I've seen people do well, and those who thrive and succeed, is not changing up who you are to try to get in or to try to do something. So follow the thing that you're passionate in. Um, Medical schools, I mean, even undergraduates at the time, they weigh what opportunities were available to you um, while you're going through this process. So, for example, sometimes that means people do some like more AP classes. Sometimes that doesn't. It just kind of is what is available to you. But really, I know it kind of sounds cliche, but like sticking to who you are, and following your path is the best way. So, shadowing, if you can, as Sabrina had mentioned, and it's relatively easy to at least reach out to people to try to get shadowing. Volunteer opportunities just to get acclimated into the healthcare system is good, because a lot of times people think they want to go into healthcare, but then they do a rotation or two and realize, oh nope, this is not for me. So trying to get acclimated if you can, but really doing what excites you is the most important.
Sabrina, you just went through it.
Yeah, I think that about covered it. I also, when in high school, I really didn't really know what I wanted to do. I wasn't shadowing yet, so I really wouldn't stress about it and just kind of see what you're interested in. And in college, I think there are a lot more opportunities. So I really wouldn't stress about it too much.
Yeah, I'm a big believer. So I took a lot of AP courses in high school, but my husband took a lot of courses at the community college instead, and they're both equally valuable opportunities. And in some ways, I wish I had been more exposed to the community college network or taken some of the community college classes, because there are so many programs that you can learn about at a community college level. There are community health worker certifications and things that you can look at, learning about public health and social work and things like those too. So I think that in high school, AP classes are amazing. I took them myself, but I also am a big proponent of trying to sit in an actual college classroom and seeing if you can take a community college course.
I'll also say So Do We is a great program to do as well. All right, so next question looks like one of the stigmas with the medical field. Is it hard to still have a good social life when you're in the medical field?
Great, great question. No, it's very nuanced. Is it hard to have? I think it depends a couple of things. Yeah. Depends on what you mean by a great social life, and it depends what you mean about going into the medical field. So, for example, I think the best way to think about it is your expectations should line up with what's most likely. So, for example, if the expectation is that you're going to be a neurosurgeon, the most likely thing is your social career probably will take a hit because residency, you do 4 years of medical school, you're likely doing a ton of research to be super competitive for it. You're in the OR 80 to 100 hours a week because if you're going to operate on somebody's brain, you got to be good at it. So the reality is you're going to work really hard. It's most people don't have incredibly open social lives during their 7 to 10 years of training. Now, after that, you're ended up making a significant amount of money, but you're also working a lot. Depends what kind of practice. Are you in a small practice or a large practice? So I think if you do certain subspecialties, that becomes harder. But other subspecialties, it's significantly easier. So I have a lot of friends who are amazing, very smart, board certified pediatricians who work Monday to Friday. There are certain subspecialties like dermatology. No emergencies. You're working Monday to Friday, but there is a portion of your life during medical training that you're most likely going to have a decreased, what might be considered normal social life because you're working more. But again, people still have phenomenal social lives. I got married and had 2 kids during medical training. So it depends on what you mean.
And I'm only getting into it. But as an undergraduate, I've definitely been completely fine. I think when you are focusing on something like this past summer, I took my MCAT and I definitely locked in for 3 months and didn't do much, but I was so focused on doing well, I didn't really want to do anything else. And I knew that it was going to end soon. So with my experience, I've honestly been completely fine.
I don't think I have anything to add to that. I mean, social workers do work weekends. They are a part of the medical team. Like, I'm not a social worker myself, but they have a pretty balanced life. They go through social work master's programs as well. And it really depends. I think I don't have too much to add to that. I don't think it's as strenuous as, being a doctor, but also there are other that you can take that can find the right balance for you.
And a question for Emily. As someone who is also interested in pursuing public policy, how come you pivoted from the public policy aspect to the more medical perspective?
I think what I found is that you can study public health, you can study public administration, you can study public policy, but ultimately, if you want to be an advocate and you want to learn about the world, you have to find your passion and what you want to advocate for. Originally, for me, I thought that was education, which is why I worked in higher education for so long, working with um, young adults, forming their identity at that point in their life, and helping them kind of maybe like first generation college students and things like that. Um, but really, what was a real passion for me when I was working with oncology patients is these are people that I feel like just got bad luck sometimes, and then to have all the social barriers on top of that, it really felt a passion for me all of a sudden to help with that, especially the way that our healthcare system is incredibly complex in the United States. I love digging into a complex system. And so, what better thing to do that for than with healthcare?
Awesome. For everyone, what is the best part of what you do?
I can go first. I don't think it matters which way we go. I mean, by far and away, it's helping patients. I think everyone goes into something again. That's why I mentioned do just follow what you're passionate in and keep doing it, and things usually work out well. But I just love taking care of kids, and to be able to help diagnose, walk them through their like worst times and their parents, and hopefully do some good and give them extra years they otherwise wouldn't have had. By far the best.
Man, I have to agree. It's when you make a change for a patient that they didn't think was otherwise maybe possible, something that was really stressing them out, being able to help them with a bill that they thought they couldn't pay that month. I love when I'm able to give out the cancer Barbies to parents when they don't know how to talk to their kids about cancer. Um, or the child books that they can read to their kids to talk about cancer, that those are important moments for me. Every bell ringing that I get to attend and take a picture with, when they finish their treatment, it's just and like I've even had people call me back, and although it's a little bit sad, I've had people call me back when someone's passed away and just say like, "Hey, I wanted to let you know because you really helped them." And that's a big thing too. Even though maybe what happened wasn't the best for that patient and in medically, to know that I could give them a little support along the way is really important.
For a more undergraduate perspective, I say the best part about being pre-med or in pre-health is just how many opportunities there are, and there's so many different routes you can go down, and having the opportunity to try them out for 4 years and seeing what you like. And I mean, I've shadowed ophthalmologists and I've seen eye surgery, and I was like, oh, I don't really like this. And I've had the chance to do child life and build these relationships with the kids where you walk in and they're so excited to see you and they give you a big hug. It's really nice to have all those opportunities and then really spend those 4 years kind of deciding what you want to do for the rest of your life.
Awesome. What did you not expect about the medical field? I know that's a tough one.
I guess I should have expected it. It's not that I didn't expect it, it's just to expect how hard it would be, is that like you just can't solve every problem. I think, and you really want to when you become a helper and an advocate for everybody at a certain point. That's the hardest thing for me, is that resources are finite and we all do our best, whether it's the doctor or the social team, but um, you do the best you can and resources are finite. And that's probably the hardest part.
Yeah, I think kind of piggybacking off of that, I don't think I expected to see so the financial burden on families for, as Emily mentioned, just being unlucky or getting an unlucky hand dealt to them. Um, Usually, at least in pediatric cancers, one parent will have to like basically go on what's called FMLA, so they're not working. There's multiple hospital visits. I don't think I appreciated the burden on families that comes with one of these diagnoses. You're already dealing with trying to help your child survive, and then on top of that, you're thinking about, well, how do we pay these bills, or who's going to watch my other kids at home, or how do I get here if I live 2 hours away, or what if English isn't my first language and I got to deal with the complexities of a medical system that doesn't speak my language. So I think there's so much nuance to everything that goes into providing care outside of just knowing the textbook.
And to add to that a little bit, I really like that point. I'd say there's so much more than what they just teach us in our science classes. And I'm happy I've had the chance to take like business classes or finance classes because there's so much more. There's public health problems, there's legislative problems, there's financial problems to do with like the whole healthcare system as a whole. And so I wish that they'd kind of give more education on that because it's more than just like the treatment and the science.
Ooh, this is an interesting one. How has AI actually changed your day-to-day routine? Is it making your work life easier or just adding more to your plate?
Um, for me, I take a class in our simulation hospital, and ever since AI has gotten a lot better, it's definitely been implemented a lot more. And we actually get to work with holograms and virtual reality, to do fake scenarios. We get to see like 3D models of the human body in these VR headsets. And so I think it's definitely made education a lot better. And we've had the opportunity to do things that we'd never be able to do before.
Um, there's this whole field in medicine called implementation science, obviously in like other fields as well. But this idea that like it takes a decade or more to implement some new technology or change into the way that things practice. And healthcare is notoriously bad at being slow to change. Um, and so my day to day isn't significantly different by AI. We like the biggest thing that has changed recently is like you can if you consent a family to say, hey, I'm going to record, like my phone's going to record you and it's going to go into my note. That can make life a little bit quicker. Um, but for the most part, I think the biggest thing AI has done is it has provided people come to us having put all of their symptoms or all of their labs or everything into AI. And so you're really spending a lot of time kind of parsing through people's anxieties or worries or fears. Um, and so yeah, I think it's interesting what the next 10 years is going to look like in healthcare. But as Sabrina said, there's a lot of ed tech stuff that's happening, but it's not in the prime time yet for a lot of patient facing things.
Yeah, I agree. I think that's something that you're going to see your generation use a lot more than ours. It's just starting and like they were saying there's a delay in getting it into the workforce. I do use AI, small AI, use ChatGPT for certain things. I use it to help me with Excel formulas when I need to build spreadsheets, which is amazing. Didn't exist before. I use it honestly. Well, this is so bad, but sometimes if I don't have quite the right words to say to a patient to be emotionally intelligent, I will use it to help me do that. And then I also use it to solve hunches. So, like, if I have a hunch that a government program works a certain way and I can't Google find that, I will use ChatGPT to point me in the right direction to solve a hunch to help a patient, if that makes sense. So, like, if I think that, for example, a program doesn't accept patients because there's a Medicare law or something that prevents them from doing that, and I can't find that, I'll go to ChatGPT and say, like, tell me more about this, and then solve that hunch that way. Um, those are little ways that I use it as a millennial, and I would love to see what you guys do with it in the future.
Any advice for the MCAT?
Well, I just recently took it. I My personal experience is I like to do it under a more condensed period of time if you have the capability to do that. So I just focused my whole summer on that. Of course, like sometimes you have to work or there's other problems. I just wanted to get it done with and to put most of my energy into it at once. But I didn't buy any like fancy $2,000 plan. I definitely used ChatGPT a lot for it, and I don't know how people did before because I would put my problems in and be like, how make this make more sense? And so I thought that was an amazing tool for me. And then I looked on Reddit a lot for people's advice, which could have also been a downfall. I wasn't really sure how I was doing until I took the test, but definitely not the best time of my life, but you get through it.
Yeah, I think everyone's a little different. Like Sabrina said, I think I had friends who were like taking courses during senior year of college. That wasn't, I just couldn't do that. I similarly was like, I need 2, 3 months to just lock in, do nothing else, and just study, make a plan, stick to my plan as much as I could, um, and go from there. So I think uh, uh, that everyone's a little different, but you have to study one thing. So what people say, your MCAT score matters. It's not gonna like, you got to at least do well. You just can't. I know many people who did very well and got into medical school. I don't know anybody who did poorly who got into medical school. And so take that for whatever you will. It's just sad, but it is true that it is a litmus test for a lot of places still. I know some institutions I think actually aren't requiring it. I think there's a few handful of them. But for those that do, um, it does matter. So take the time, figure out what works best for you, and just study as much as you can.
Awesome. There's a lot of questions about helping to secure internships or shadowing opportunities. So, any advice for that?
For shadowing, I just drafted a email template, kind of explaining myself, what I was hoping to get out of it, and I just went on my university homepage, or you could look at maybe local hospitals, and I just mass emailed this and just substituted their names. And whatever specialty you're interested in. And honestly, you're gonna send out like 30 and get two people who say yes, but you just have to be consistent with it, and eventually someone will say yes. But I really didn't know anyone beforehand. I just cold emailed, and it worked. It worked pretty well.
Every hospital
Yeah,
that
that's
I'm
great. I think
Sorry, I was just going to say every hospital I'm aware of has a volunteer services office, and I would definitely reach out to them. Even if you're not, like Sabrina, finding the exact shadowing match that you want, if you do some volunteering in the hospital, I think that doctors are going to say, okay, this person is serious, and then you're going to do better finding someone who will accept you to shadow. So don't be afraid to be a medical transporter for a hot minute, to get to where you need to be.
spot on. Absolutely spot on. Yeah, I think sometimes when you're in your position, you're worried or in like thinking about showing or internships and things. People, when they're sent, I think sometimes we have the mindset that you're like bothering somebody. That just like isn't a thing. It's just like people want to try to help out if they can. If you don't get a response, as Serena said, one of two things. It's never wrong to re-email after a certain amount of time because I get emails all the time and there's a chance it just got buried. And so a email a lot, and B, being okay with following up. If you don't hear something after a second time, fine, maybe that's not the person. But um, I think a lot of times does help get you through a little bit. But the other thing is as both Sabrina and Emily were saying, it's exposure. So if for some reason you're trying to shadow and people aren't agreeing to it, or you don't have anybody in your family who was in medicine, which happened with me, and so I didn't shadow at all until I got to college and like got exposure with child life. But just finding a volunteer opportunity that may link you to somebody who then you may have an opportunity to shadow them, or to they may know somebody you can shadow. So it's all about just trying to get as much exposure as you can. Hopkins has a shadowing program, if I remember correctly, and so yeah, there's a lot of opportunities out there, but really it's trying to expose yourself to as much as possible.
What I also would say about hospital volunteer service offices is that typically there's like a registration process that becomes part of being like a hospital volunteer. You usually have to have some health tests and stuff done. And if I'm emailing a doctor and saying or whatever that I want to do shadowing, and I can say, "Hey, I'm already a volunteer here and I'm already like I've done my registration. I could start, in 2 weeks or whatever." That's a lot more appealing than me having to tell you to go to volunteer services and do all those other things.
All right. What is the general pathway for students who want to go into medicine after high school? Is there always a clear path?
No,
I,
there's no clear path, really. I mean, I think the generally accepted path is high school to college, 4 years of college. Um, you need an undergraduate degree. You need a 4 year undergraduate degree in order to apply to medical school in the United States. So, undergraduate degree, and then potentially or not, but it's more often than not just by the numbers game that you will potentially take some time off before. And if you're doing that, it's really the whole thing that medical school applications are going to want to know is what is your story and how does it weave into you needing to be a doctor. And so if you leave undergrad and then do nothing to like further knowledge or volunteering or shadowing or work in the medical field, they're going to say, well, what have you been doing? And it's harder to get in. So using that time to try to really parse out if you want to do it, and then applying, as Sabrina obviously knows, and it's a lot of applications, and then kind of that's the path. But you can add in and weave in your story however you want. So I know people who did consulting for 2 years, and then that's what got them interested in medicine. I know people who were in law, and then that's what got them interested in medicine. People who were in government or politics. There's no one defined path, but the general skeleton of it is that.
Yeah, I am not, in the medical field in that way, but I have two friends that are nurses, and I can tell you they have two very different stories. Taylor, my friend, he left high school, went to a community college for 4 years, and became a nurse, right? Whereas my friend Elliot, was a coworker with mine, thought she wanted to work with students like myself in higher education. Then the pandemic hit, and she thought maybe she wanted to be in risk management and started to work at one of the Max Vax clinics. If you guys remember, where everybody got vaccinated at M&T Bank Stadium, right? She was at one of those. And then that's when she decided she wanted to be a nurse. Now, she already had a master's in higher education and she had an undergraduate degree, but because she already had her undergraduate, she was able to do one of those 18-month shorter nursing programs. So two very different stories, both ended up as nurses, right? I mean, I don't know. You can go lots of ways.
If a student isn't sure about a specific field but wants to go into the medical field, what would you recommend exploring?
I would say to shadow. That's what I did. It kind of gives you some insight on what whatever that role may be. So if you're not sure where in the healthcare field you want to be, maybe shadow a nurse, a PA, a physician, kind of like feel it out. And if you know you want to be somewhere in the healthcare field, I just started with a general health science degree and I wasn't specified into anything, so I took more general classes and that gave me a lot of wiggle room.
Cool. Are those expensive?
Yeah, I
Oh, go
mean,
ahead. Sorry.
nothing about. I don't have really anything to add to that. Honestly, it's just like yeah, just if you're talking specifically about if you're talking about sort of different areas of healthcare or providers you could be, then yes, I think everything Sabrina said was great. If you're talking about inside healthcare, you just need when you're applying to medical school, they just want to know that you're trying to get exposure, and then once you're in medical school, that's when you really figure all that out. You really get exposed to every single specialty that you could do and learn the intricacies of a lot of them and what that work life balance looks like. And so you will have a plethora of opportunities in medical school to do that. So just try to do any.
Yeah, and I have to add just, again, like you don't have to be, you can also be interested in social sciences, you can go into health policy, you can work in healthcare administration. I mean, there's lots of people that make the hospital run and they're all important. You can be like myself and be a patient navigator, right? And I got my certification just recently, like within the last year after having some experience. So, um, I honestly, if I was to go back and do it all again, I wish I had spent more time reading through like the majors and certifications that were available in college, right? Like I just like picked at random and I wish I had actually looked at the catalog and said what jobs do these lead to? Um, which I didn't do.
I know you all recently just talked about nursing. So one of our members is up in the air about pursuing a career in nursing. Would it help to intern at a clinic for her senior year of high school?
I don't think it would hurt.
My wife is a nurse. Yeah. Completely agree. My wife's a nurse, and that's kind of how she did like an allied health sort of program in high school, and was kind of shadowing. Yeah, I think it's great. I don't think it hurts at all, and I think it offers you the opportunity. I think a lot of times with people, it's better if you can do things earlier, get exposed to things earlier, and you're like, actually, no, I really don't want to be a doctor. That's better than going down the path, which I've had some friends who didn't think about if they wanted to do that until they were like 2 years into medical school. And so the earlier you can do some of these things, actually, the better. So yeah, and again, you can always, if you don't like what you're doing there, then just kind of pivot.
I don't know. I don't know if I'm freezing or not. I'm going to take a somewhat controversial approach here in that I do not think that would hurt, but I am a big believer in paid experiences. And so, I don't know if that experience is paid or not, but I do think that there might be other experiences at a hospital where you could also get some money and some exposure. I don't know. So, I'm a big believer in paid experiences. If you could be a registrar for a little while, maybe, and make a little money doing something like that. Maybe it's not exactly what you thought you were doing, but you're still in the medical world and you get some cash on the side. Sorry, that's a little, maybe a little controversial, but that's my.
I mean, that actually kind of leads into our next question too. Kind of the opposite side of things. Those expensive medical summer programs, are they good and are they worth it?
I've never done I've never paid to go to the hospital or to be a part of like I've done it for free, but I've never paid them. I don't think it's worth it. I never did any summer programs. If you can just volunteer, I feel like that gives you just as much experience.
Yeah, yeah. I think the hierarchy, uh, I mean, it's a hierarchy. It's, as Emily said, if you can find something in the medical field and get paid for it at your stage of the game, power to you. That's the best way to do it. So it'd be getting paid, and then the second tier would
Breaking
be
even.
not getting paid, but not paying. So the volunteer, which is what Sabrina said, and then the third tier, I agree. I haven't done anything where you pay to be part of some program. I just think there's too many A opportunities out there. Yes, they're competitive, but A opportunities, or B things that people aren't thinking of, that I would much rather like go do something creative on your own than try to pay some institution to. I don't know. I feel very personal. I feel you pay so much money in medical school. I feel awful that they're doing these programs. Personally, I
All right. Throughout your medical career, have there been moments where you questioned your path and what allowed you to persevere through those challenges? Dr. Jimmy, you want to go first?
y'all just ask great questions, man. These are thought provoking questions. Yeah, I mean, I think yes, everybody in the medical field. I think if you talk to enough people, particularly on the physician side, I don't know if it's different from other aspects. I'm sure it's similar. There's always a moment where you're like, why am I doing this? Because there's pretty good evidence that your 20s, and again, if you're, this is physician, I'm speaking from a physician standpoint, your 20s are taken up by almost purely learning and making very little money. Where your friends, who I have friends who I graduated with college, went into business, and are making significant more and have for the last 5 to 7 years of their lives. So you're giving up a lot. A lot of people get married later. A lot of people have kids later. Um, and also, people don't do well. Not everyone does well. And so it can take a toll on you. And I think it's in those moments, it's why a lot of medical schools will say, why do you need to be a doctor? Because if you don't really have that core desire to like go into this, then at some point you're going to pivot and do something else, which is totally fine. But I think the thing that's helped get me through is having a lot of great friends, both in and outside of medicine, to just bounce these ideas off of and talk to, and just kind of reflect.
I never questioned why I got into the patient navigation gig that I'm in. I love my work that I'm doing now, but I certainly questioned when I was in higher education. So I think at some point you may question different parts of your career. And as I said before, for me, I realized that I wasn't advocating for what I was most passionate about or the people that I always knew that I was going to be an advocate. That was always the theme throughout my education, that I was going to be some sort of social justice advocate. I wanted to work at a nonprofit or, you know, a government organization, something like that. But I realized that higher education in the way that I was working in it was not working for me, and I needed to find something else. And so that's actually how I ended up in this patient navigation healthcare kind of role. So, and it was hard. I'm not going to sit here and say that it wasn't. Like a career existential crisis is incredibly hard, but I was lucky enough to have support with me and to make that jump just fine. And um, it's okay to change careers paths in your 30s.
And I haven't made it that far in my medical journey, but I would be lying if I said that in the middle of MCAT studying, I didn't question my whole life and my decisions. But I think when you're just studying for tests or if you're studying in a classroom, you can think about that. And then when you go and you actually work with patients or you go in the hospital, all of those thoughts would disappear. And I really felt like I was where I wanted to be. And then I've also taken other classes, like I'm in a law class and a computer science class right now, and it's really reminding me that I definitely want to be a doctor and that those are not the paths I want to go down. So I think it's also good to try other things to kind of check if you're on the right path for you.
Awesome. Final few questions as we get close to our hour mark. This one actually I can also partially answer. Is it possible to manage a Division I sport while in medical school? My answer for that would be yes, but this will go back to that social life thing. It's not going to happen. I managed a Division I sport while I was in college, and that was a 12-hour day on top of my classes. And I wasn't taking any medical classes. That probably would be a lot more studying than what I had to do as a sport management major.
I have a few friends in clubs that are on like our dance team or football team, and they definitely do it, but I do think something has to kind of give in that. And so if I had the choice, I wouldn't do both, but if it's doable if you really want to do both.
Yeah, and I think that's where this idea of like starting medical school later, average age to enter is 24, which means you take 2 years off. Um, that's usually what happens. In my medical school, there was a Division I quarterback, and you're not a quarterback. You're not in medical school while you're also competing in undergraduate Division I sports. So, because again, you need to have graduated. You have to have an undergraduate degree in order to apply. So you're not in medical school happening. But yeah, doing it at the same time would be challenging. Possible. I was a manager of one school, but again, then I took 2 years off. So um, I just think there's a lot, and I think it's better to kind of really focus in on the thing you're doing at the time. If you're gifted enough to be playing Division I sports, I think continue that. And but also medicine is there. But I would at least some stuff to prepare you for that. But yeah,
Okay, I know nothing about D1 sports, but I do know that I took a lot of AP classes, and when I did enter into college, I had over a year of credit like in place. And so, and whether how you get that credit through a community college, AP, what's the other one that people do? I don't remember. But you know what I'm talking about. Like it helped, right? Because I had the flexibility to flex my coursework, because I already had the credits that I need coming in. It also meant that I took all my APs and classes that I liked. So then I had in college to take like I didn't have credit in anything that I didn't like, so then I had to take a bunch of classes that I didn't like. Like, I'm not a science person, so I had to take like baby bio, and it was terrible. Okay, so that's just my piece of advice about AP classes.
All right, I think this might be our final question unless another really good one pops up. If you had to choose one, what would be the biggest lesson or takeaway you've learned throughout your career? Sabrina, you can go first this time.
Okay. I think the first thing that comes to mind is to just stop stressing out. I am a certified tweaker. That's what all my friends call me. I just worry about everything and part of me just likes to worry about it. But eventually, like I know I'm just gonna be worrying my whole life and I need to stop. And so I think I've gotten better at it over the past years and I've stopped freaking out before every test and I think that's a good lesson to learn. Because my heart's gonna give out eventually.
What was the question, Andrew?
What's the biggest lesson or takeaway you've learned throughout your career? Dr. Jimmy, you have one?
Yeah, yeah. I'm gonna develop politics and give you two answers. So I think there's a personal. The first one's personal. So the biggest advice to express is everybody's path in this process is different, and that's totally okay. Like totally okay. So if you're around, and like Sabrina said about stressing, if you're around people and you're like, man, they've got it all put together, these schools are going to want them, not me. Okay, that's them. But like your path, again, um, as Emily said, pivoting a career in your 30s, two careers was not what they wanted. And so they go back and they don't have school. And like, okay, got it. Like, so everyone's path is different. The key is not comparing your path with somebody else's. It's just showing up every day to try to do your best. So that's the first thing. The second thing, I think medicine, the best piece of advice is it is not about me. It is not about you. It is not about the other doctor, nurse, patient navigator. It's not about anybody but the patient. Because our day at work, again, it's kind of common medical terminology. Somebody in the medical field, their day at work is one of the worst days of somebody else's life. That's when you meet the patient, usually on their worst day of their life. So therefore, if you go into this field, you cannot make it about you. It is about the patient and their family.
I think the part about not comparing yourself, I mean, I can't, I'm putting that nugget of information in my mind for about the patients, trying to remember that. So I think that's great advice in the healthcare field and not comparing yourself to others, and stressing are also great pieces of advice. Like if you're happy where you are as um, I don't even, a nurse or a doctor or a patient navigator, wherever you are, there's always going to be, you don't always have to keep climbing if you're happy where you are, if you're making a difference and it feels good to you. Um, so I would say that like we're kind of like, or at least we in the US, we grow up in this like achievement culture where you always have to get to the next stage and the next level. And that's what causes us a lot of this stress, this tweaking, right? And it's okay to say, no, I'm happy in my job right here for now, and to keep reassessing that as you go. And if you're not happy, that's the time to make a change.
One more question, I promise. This one was good. Is there any single person that really influenced you that made you want to get into the medical field? I don't know if you can pinpoint one person.
I kind of touched about this earlier when I was talking about getting into it. I would really attribute the first physician I shadowed as really being like my initial spark as wanting to do this. And I really think his patience with me, and I think a lot of the time, you're shadowing and you're kind of like a fly on the wall, and he was really kind. He like let me look over the results and talked through everything with me, and it made me feel like that's something I really wanted to do. And so I really attribute it to that, and I definitely recommend that everyone go shadow and meet influential people.
For me, that would be Dr. Jenny Owens. She's the vice pro provost of student affairs actually at UMB, and she had an experience with her own child having a medical situation that encouraged her to be a social advocate in the medical field. But because she, like myself, also had a background in higher education, she was willing to take that chance on me and see the advocacy skills that I could bring into the healthcare field. And so I really loved her blend of an academic mindset, and an advocacy mindset in the healthcare setting. Yeah.
Uh, and then for me, I don't think it's one person. I think there's been so many people throughout just my life who like you take a nugget or you take some bit of wisdom from them, or you like their style. And so I've always just been so like interested in like you can give a human being some chemical or medicine and it can like cure them. And so I think yeah, I've always been impressed in people who have the lasting like impression on are ones who are like curious, and both a good quality that like, leave an impression on people. So, but not one in particular.
Fantastic. Well, that is all the time that we have for today. So just a quick wrap up for some next steps. If I can find my presentation. There we go. All right, so just for some next steps, just for everyone, keep working towards change makers. I'll make sure we send everything out to all of your team leaders. If you have any questions about change makers, please let me know. If you want to schedule a meeting with myself, please do so. I know Sabrina can definitely attest. We're very good at brainstorming and it's very fun. And we can make the whole process a lot easier and a lot more enjoyable for you as well. And one thing that I've noticed just from my conversations from a lot of you, as well as a lot of your schools and classmates, make sure you're bragging about what you're doing. Because what you're doing is not normal for a high school student to be doing, to go out of your way to be supporting young adults with cancer. Again, while you're already busy with your schools, your extracurriculars, everything that's going on as you're preparing for college, brag about what you're doing. Get more comfortable with bragging about who you are and what's going on. The more you brag about yourself, the more people are going to become aware of what you're doing, and the more people are going to want to support you. So let people know what you're doing. Let people know about So Do We. Let people know about Ulman and what we're doing as well. The more you brag about it, the more people are going to get supported, the more people are going to get helped. But we do really want to thank all of you for joining us tonight. A very massive thank you to our panel tonight. That was unbelievable. We actually went overtime, which is crazy. This was now the largest educational class that we've had this year. So thank you all for showing up, having such amazing questions. Really, this was absolutely fantastic. But we really hope that you all have a great rest of your week. Please try to survive the rest of this lovely winter weather. But thank you all again for showing up. Have a great week and have a great weekend.
Thank you. Thank you so much.